welcome to the third episode of the Dysmenorrhea Project podcast, exploring endometriosis. My name's Sanghavi.
I'm Jacqueline. We're two medical students who are passionate about women's health and want to take you all with us on our journey to learn more about this underrated side of medicine. Today we'll be discussing a very widely known condition known as endometriosis. We'll cover what this condition is, its prevalence in the community, risk factors, and causes for this. Alongside, we'll discuss potential symptoms, how it can be diagnosed and also treated. As a special insert, we'll also debunk any common myths about endometriosis, so stay tuned for that. So just to define what endometriosis is, it's defined as growth of endometrium-like tissue outside the uterus, and the uterus is basically a pear-shaped organ in the reproductive system. Endometriosis is referring to the tissue lining the uterus, so it can be commonly distributed in the pelvis, which is like a bowel-like structure that sits underneath your abdomen. And it also can exist like outside the pelvis, but that's a bit more rare. It is hormone mediated and is associated with menstruation. So hormonal changes during the menstrual cycle can induce bleeding, long-term inflammation, and also scar tissue formation. So how prevalent is endometriosis in the UK?
Endometriosis is actually one of the most common gynecological disorders in women of reproductive age, and in the UK it's the second most common after fibroids. 1 in 10 women of reproductive age in the UK have endometriosis. This comes to around 1.5 million women in the UK affected by the condition. On average, it actually takes around 8 years for a diagnosis to be given after symptoms onset. So I'm sure you will find it useful to find out more about endometriosis so you can advocate for yourselves. So in terms of risk factors, they include early menarche, so that means early periods and signs of puberty occurring roughly before 8 years old. They include late menopause, delayed childbearing, having never been pregnant or having never born children, having a family history of endometriosis, having a condition where you have vaginal outflow obstruction, being of white ethnicity, having a lower BMI, having an autoimmune disease, or smoking. Since this affects so many women, many of them would want to know what this condition is caused by. So do we know the exact causes of this?
So the exact cause is actually unknown, but there has been a few sort of mechanisms that sort of tries to explain why this condition is occurring. And there are a few. So the first one is called retrograde menstruation. It basically describes the endometrial cells flowing backwards from the inside of the uterus, or also called the uterine cavity, and implant on the pelvic organs where they can continue to grow, so causing the pain. The other one is genetics. So there isn't a specific gene that's identified, but it was proved in certain studies that it's related to genetics. The third one is metaplasia, which basically means that cells in the pelvis and abdominal region sort of change into the endometrial cells. And the last one is environmental factors. So some animal studies suggest that the exposure to environmental toxins can affect the body, including the reproductive system. So how can women tell if they've got endometriosis then?
So endometriosis is often suspected in women presenting with one or more of the following symptoms. These include chronic pelvic pain, so this could be pain that's been lasting over 6 months and is cyclical or continuous pain in the pelvis. Period-related pain, also known as dysmenorrhea, which is pain that is so severe it affects your daily activities. Deep pain during or after sexual intercourse. Period-related or cyclical GI symptoms, especially painful bowel movements. Also urinary symptoms that are period-related or cyclical, especially blood in the urine or pain when passing urine. And one of the main complications of endometriosis is actually infertility, which may be associated with the symptoms I've mentioned before as well. So in terms of investigations, often what they'll do is take a detailed history, discussing the symptoms, identifying risk factors and other possible conditions it could be. They may ask you to keep a pain and symptom diary that could help with discussions around the symptoms of the condition. They may do an abdominal and pelvic examination to identify any masses or signs in the pelvis. Although it is to be noted that some people may be asymptomatic, and so they shouldn't exclude endometriosis even if the examinations are normal. But a definitive diagnosis can only be made by laparoscopy in the pelvis. That's when they put a camera in the pelvis to investigate if there's anything there. Although they may use a less invasive method such as ultrasound, which is using sound waves from the outside to try and image what's inside. And so these are the kind of things that would be used during an investigation. So, having received a diagnosis, how may the condition be managed?
So there are a few methods that can sort of manage endometriosis. So for example, if you've had the symptoms and you're worried about what's going on, you probably go to the GP about it. And they probably give you sort of pain relief. So most commonly used is paracetamol. So a lot of people know what paracetamol is, which is a painkiller. And they can also give you steroids, which for maybe 3 months, like a short time period. And steroids basically are anti-inflammatory painkillers. So they sort of stop the pain or reduce the pain by reducing your inflammation. The second one is hormonal treatment. So for example, like combined oral contraceptive pills, giving you progesterone in the form of maybe pills, injectables, or an implant. They can also consider any social factors for the patient. So take into account like the circumstances, if they're experiencing any like emotional stress or needs, fertility desires and cultural backgrounds, etc. So after seeing all those symptoms and medication doesn't really work and there's persistent symptoms or other worrying sort of signs, you might get referred to the gynecological service to sort of investigate deeper. And we've gone over the diagnosis methods for the condition. So the last type which is considered a more invasive approach towards this is surgical management. And the first one is to do a laparoscopy, which is a thin telescope-like camera that's inserted within some instruments pushed under your abdomen to remove any like endometrial tissue, or something called hysterectomy, which is removal of the uterus in very severe cases. So through previous interviewing with other women, we know that they tend to look for treatments that don't involve medications due to all sorts of reasons. So does this apply to endometriosis?
So there are several non-medical ways that pain can be managed. Some of these include ensuring you are properly hydrated. This could help with reducing bloating and the intensity of any cramps that occur. Also heat therapy, so this is a hot water bottle or having a warm bath. This can help to loosen and soothe muscles which are cramping due to pain. You can also do light to moderate exercise, so this could be walking or yoga, which would release endorphins and also has been shown to reduce estrogen as well, which contributes to the inflammation and pain. There's also something called an endometriosis diet. So this is essentially a diet which decreases inflammation. So diets which are known to be high in meat and fats, and such as in processed foods, are known to increase inflammation. So trying to avoid those, but eating more of foods which are high in vitamins C, D, and E can help to reduce the pain. There's also something called transcutaneous electrical nerve stimulation, which is not as scary as it sounds, but it's essentially when electrical pulses are passed, and they can help to disrupt the pain messages in the nerves and encourage endorphin release. Similar to this is acupuncture. It works in a similar way to use fine needles at specific points that can interfere with these pain pathways and stimulate endorphin release as well. And also other classical methods include massaging and osteopathy to massage the soft tissues and surrounding muscles and reduce cramping. So what are the outcomes for endometriosis usually?
So endometriosis is not cancer, so that's a misconception. And the progression can vary depending on person to person. If it's left untreated, it can actually improve by itself, stay the same, or even get worse. So it's also considered a progressive condition, so it will continue to grow and symptoms may worsen because that is growing. So it can be pain that may actually extend beyond your periods at different times of the month. Up next is our section of Beating Misconceptions, where we'll show a statement and explain why it's a misconception about the condition.
Starting with myth number 1, the symptoms are just a heavy period.
Women with endometriosis sometimes assume that their symptoms are a normal part of menstruation, and when they do seek help, sometimes they get dismissed for overreacting of the normal sort of period symptoms. But in fact, that something actually might be ongoing and it can be more serious than what people think. So we've already talked about sort of potential causes and mechanisms for endometriosis. So our audience by now should know that this statement isn't true. And we hope that you can feel more empowered to advocate for yourself as well.
Myth number 2, endometriosis only affects the pelvic region.
Even though the most common locations for endometriosis growths occur within the pelvis, they actually can occur anywhere in the body. So outside the pelvis, or even in rare circumstances, it can actually be found in the lungs as well.
Myth 3, endometriosis is always painful.
Not everyone with endometriosis experiences pain, so it's not uncommon for a woman to actually learn about the condition that they have after when they realize why they are having difficulty getting pregnant, so when they start investigating the reasons. And having the condition actually increase the likelihood of miscarriage and other problems in pregnancy. But the good news is that the vast majority of women with endometriosis are ultimately able to have a child. Myth number 4, endometriosis can be prevented.
So there's currently no clearly understood cause for endometriosis, and so at this point there is no known way to prevent it. Certain steps can help lower estrogen levels in the body, which, according to the US Office of Women's Health, could reduce your risk, as estrogen can fuel the growth of endometriosis and magnify your symptoms. But for the general public, it's almost impossible to know how to avoid this often painful disease, at least with current research.
Myth number 5, endometriosis always improves after menopause.
Although endometriosis symptoms occur most often during menstruation, for some women they can last well after your periods end. Even after a woman goes through menopause, the ovaries continue to produce small amounts of estrogen, and endometriosis growths may continue to respond to this hormone, causing pain. So while symptoms of endometriosis improve in many women, menopause doesn't bring relief to all. Some women who have gone through menopause may opt for surgical procedures to remove endometriosis implants or adhesions, or even a hysterectomy or oophorectomy, which is when you remove the ovaries. However, these procedures are not always successful in controlling pain.
And that's a wrap for this episode by the Dysmenorrhea Project. We've learned lots about endometriosis, and hopefully this has increased your understanding and debunked any misconceptions relating to this disease. The sources used in this episode and links for further reading are listed in the description box.
Please make sure to like and subscribe to our channel and follow our Instagram page for more future content regarding women's health topics. Looking forward to seeing you in our next episode.